Good morning. As we continue to move forward to open up some more businesses in St. Louis County in a slow and cautious way, we will continue to ensure that public safety is our top priority. On June 1st, our guidelines for summer camps, June 1st, our summer camps will be allowed to be opened, and our guidelines are now posted on stlcorona.com. While summer camps will be allowed to open under guidelines similar to daycare, they will continue to have social distancing requirements. They will continue to follow cleaning and disinfection requirements, but they will not have occupancy limits similar to daycares. Large group activities will not be conducted. Parents and guardians will drop off their children at the entrance, or if there is a circle drive, then at the curb. Parents and guardians will not leave their vehicles, but an attendant can open the door and let the child out or in. Family meet and greets will be conducted virtually, and there will be no visitors to day camps. We have set June 15th as a target for pools, youth and adult athletics with no fans, and gyms. Gyms remain a high-risk concern because of inability to wear masks due to limits on breathing, and breathing when working out is high risk for transmission of aerosolized droplets and the spread of coronavirus. So while June 15th remains a target, we will continue to watch the trends of testing and hospital admissions as we continue to consider more openings in St. Louis County. We will continue to work on guidelines for these activities, and they will be published early next week. The guidelines for day camps are available now on our website, stlcorona.com. We did meet with some gym and fitness owners in my office on Wednesday with my public health director and some of my staff. I was able to attend the meeting for a short time. We appreciate the partnership of these owners who are working hard to make sure that they can provide services in our community that protect the health and safety of their employees and their visitors. They have made it clear that they are working hard on a business model that does just that, and we will continue working with them on those guidelines. As we see across the country, everyone is having this conversation, trying to get our gyms and fitness centers open while protecting the health and welfare of our community, and that is why they are in the second phase of what we are talking about. To provide a safe environment, we want masks to be worn in the workplace, and we want masks to be worn by our public whenever social distancing isn't practical. With the CARES Act grant, St. Louis County has purchased millions of dollars of masks, and we are working hard to distribute them in the community. This afternoon, our regional response team, led by Dr. Jason Purnell, a Washington University professor, will work with Prepare STL, which is funded through the Missouri Foundation for Health, to pick up 138,000 masks purchased by the St. Louis County CARES grant, stimulus grant, and those masks will be distributed along with our Department of Health to high-risk neighborhoods in St. Louis County. Also, North County Inc. will pick up 16,000 masks to distribute to businesses in North County. We have another 100,000 KN95 masks that we are going to distribute with the Clergy Coalition through churches in North County. And we have another 150,000 masks that we're going to distribute with community partners throughout St. Louis County. We have a long road ahead of us, but we will continue buying PPE, and as we work to move forward in our community, to begin to open our economy in a safe and cautious way, and try to get back to work, back to our places of worship, back to our favorite restaurants, and even back to getting haircuts. Please have a safe and happy Memorial Day weekend, and remember those who have lost their lives in defense and in protection of our country. And I would be glad to answer any questions.
Can you talk about bars at all? Bars, larger event space?
Yeah, bars in St. Louis County that aren't associated with a restaurant tend to be large entertainment venues with crowding. And we see how that's gone across the country and across the region. And that is something that we're looking at later in June as it stands now. If we see a more promising trend in our data, we could consider something earlier, but bars and entertainment venues in general are something we're looking at later in June. Don't have a hard date for that yet.
Could we say that by the end of June we should expect to see hopefully most things reopened in the county?
I think by the end of June that would be a target, still with small crowd sizes and limitations of capacity. But again, we're not ready to make a commitment on something that's 5 weeks away because so much can change so fast.
What was your, sorry, go ahead.
In Illinois, we just saw Pittsburgh announce some revisions for phase 3. Their gym plan was to allow one-on-one person training indoors and then group training of 10 people or less outside. Is that something the county has considered? Something we may see in the guidelines?
Yeah, we're working on those guidelines. I think we have to recognize that workout facilities, gyms are a very important part of our health, our physical health and our mental health, and we want to get them open. But we also have to recognize this is one of the highest risk opportunities for transmission of COVID-19, and we have to do it responsibly. And we see this across the country. This is not a conversation that's limited to the St. Louis region. But I can tell you that we have been in communication with some very thoughtful and responsible folks who want to help us set those guidelines and work together with us in a partnership to make it safe. They also recognize the challenges, and we're going to continue that conversation like we do with every business, every business sector in our community. We worked with them in partnership to develop their guidelines moving forward.
I know you said you only met with them for a brief amount of time, but can you talk a little bit more about what those conversations were like? Because I think we all know that there have been some relationships that have been contentious at times with certain gyms here in the county. So did you hear some of the frustrations?
Absolutely. I mean, everybody's frustrated. Everyone whose business is limited, and that is their way of life, that is their way to make a living, are extraordinarily frustrated. That's natural. That's to be expected, and I respect that, and I understand that. But we had a very cordial conversation. I think the folks we met with are extraordinarily responsible and thoughtful, and they presented a plan that was thoughtful, and we're going to incorporate their guidelines moving forward. But what remains to be a fact that every public health official and everyone with any medical expertise in this area understands that heavy breathing that goes along with a good and efficient workout without a mask, because you can't breathe with a mask on when you're working out, you can't breathe well, then that is a high-risk transmission environment, and we have to be very thoughtful about it, and that's why we're having this conversation here in St. Louis, and that is why we're having the same conversation across the country, because this is a very unique and challenging environment. But I can tell you that we're committed to working through it, and I can tell you that there's a lot of responsible gym owners that are committed to working through it. Whenever you see confrontation, whatever business sector it is in, it will become high profile and it will seem to be the norm, but I can assure you it is not the norm. That the vast majority of businesses in every sector in our community want to do the right thing, they want to do the safe thing, they want to protect their employees, they want to protect their customers. They're in this for the long haul. And the ones that are outliers generally are outliers because of a communication breakdown. And when we communicate with them about what's safe, they want to do what's right. And then a small percentage of those will choose a different pathway, and we'll deal with that on a case-by-case basis.
What does capacity of pools going to look like for kids that want to make? Is there going to be a cap on that as well? Or?
Well, you won't be wearing a mask in pool. And so that's a little bit of a challenge, but we do have, as of last week, some pretty good guidelines that came out that are now widely accepted nationally. And as soon as we get new information and new guidelines, it comes every day from the CDC. This is a very fluid and fast-moving environment with a new virus that we don't completely understand in our country or in the world. So as soon as we get those guidelines and we have a pathway to do what's safe, that protects the health and welfare of folks in St. Louis County, that's what we do. And we believe we can get pools open by the middle of June and do so safely, make those guidelines widely available, and get kids back in something that's very important to them. But the first priority will always be public safety and protecting the health and welfare of people in St. Louis County.
Is there anything about going to the pool, let's say, that a kid may look forward to that might look a little bit different than something not to get their hopes up?
Well, let's wait and look at the guidelines. I don't want to parse those today without having them in front of me. They're not completely finalized. There's some that are available on the internet from reputable sources, and ours will look very close to that. There's national associations for pools and swimming that have something that will be very close to what we do here in St. Louis County.
Are there some gyms that are getting permission from the health department to do one-on-one private personal training?
I'm not down in the details that much. I generally let the public health director make the decisions that she thinks is right, and there may be some exceptions across business sectors depending on specialized situations. I don't know the answer to that.
There was a letter recently published from an area doctor to the mayor, but he cites the STL Corona website in that letter, and he talks about, he quoted that none of our zip codes in the county exceed a 1% infection rate, and that he, quoting him, says it's a, quote, serious overreaching of power to maintain this lockdown far after the sign that this has let up a little bit has passed. Can you respond to that?
Sure. There is an enormous amount of criticism of the decisions we've made on both sides, and that's the country we live in. People get to say what they believe to be true, and we listen with respect, and we listen to their ideas, and we incorporate that into the decisions we make. But my administration is following the guidelines of the CDC and adjusting them to regional differences in St. Louis County. We're following the guidelines of our public health officials, doctors and scientists, public health experts at St. Louis University and Washington University, and we will continue to do that always with public health and safety in mind. As to where you draw the line for stay-at-home orders, you could argue to draw that at a street, at a municipality, at a county, at a state. But if you look across the country, most of these guidelines are developed, and decisions are made at a county level. And we will continue to make those decisions that benefit St. Louis County. I think that's a pattern that we see across the country, that we make decisions based on a county level, because that's kind of how people have most of their activity. Their daily activity is moving about a county.
You mentioned all of the masks that St. Louis County has now. Why have mask purchases not been put out for a bid?
Well, I assume they are bidding those, but I'm not involved in procurement. I know that they are looking at those bids, but I don't get involved in level of procurement. That's done by emergency operations and our public health department. I think that there is a general rate that they follow for those purchases. When we first tried to purchase masks, they were $10, $12 a piece, and now they're running around $3.50 a piece. And I think if they're buying those masks in that range, they buy as many as they can get. And I would imagine that they're going to purchase as many as they can get until we get down to, we feel like we have enough in our community. Masks and tests and anything that is very difficult to get across the country, we tend to buy them whenever we can get them at a rate that we believe is competitive, because it's so important to get them out in the community. And any kind of emergency situation, that's what we're going to do. When we get farther away from the emergency, then we will try and be more deliberative in those purchases. But right now, I think everyone in our community agrees when it comes to tests, when it comes to masks, we'll get the best deal we can and move forward. And there's always this tension between protracted procurement processes. In an ideal setting, we take months. In an emergency, we try and do it quickly, and we try and do it responsibly. But to be honest with you, I'm not down in the details of purchasing or procurements or contracts.
Do you have a ballpark number yet on testing, investments in testing that the county has been able to make to date? Yeah,
the testing access in the county is moving along pretty quickly. Actually, I never have been inspired by our ability to purchase tests in the first 2 months of this pandemic. But what's happened over the past week is that our supply is opening up. And we have many, many more people, businesses, organizations performing testing in the county. I had heard this week that Walgreens was going to start a drive-through operation. Our federally qualified health centers are doing a great job in North County with their mobile testing. Our health systems are increasing their activity. Our public health department is purchasing more tests and doing more tests. The private labs are continuing to have more volume. LabCorp and Quest, and urgent care centers are performing testing as well. Testing in St. Louis County. St. Louis County is a diverse county of 1 million people and will be performed by many different organizations. The most important thing is that the county public health department gets those test results back quickly, within hours, so we can find the people who are positive, get them the help they need, do the contact tracing, and get the folks that have come into contact with them tested. We are now reaching the point not only where we can test everyone with symptoms, but we can start to test high-risk individuals who do not have symptoms, people in congregate living facilities. We're starting to move through those now. We've tested inmates in the jail and juvenile justice center. They're high risk in congregate living. We are going into high-risk communities and testing asymptomatic individuals there, and we'll continue to do that.
So it's safe to say, it sounds like you've reached the goal of anybody who wants a test can get a test?
Yes, I believe so. We're there. We're pretty close. Now, certainly anyone who was exposed to someone who was positive, who is asymptomatic, anyone in a high-risk community or high-risk setting, and I think that will expand as I know that the governor said something about getting more tests into St. Louis. He sent 8,000 tests last week, and that helped us get to the point where we wanted to be by testing everyone who has symptoms. But there are many, many people contributing to providing more tests in our region, including a very aggressive purchasing plan by our health department. They are exploring the option of a saliva test, which would make it much easier than the nasopharyngeal swabs, which is pretty annoying. And once we can validate that test, if we're able to get those tests, we can validate it. I think that'll change our testing footprint as well.
Sam, I have a couple of questions if the folks in the room are finished. From the Post-Dispatch, can you respond to statements by Dr. Will Ross that the lack of coordination between the county executive and the mayor have hampered the efforts to mitigate the spread of the disease?
Well, I think our public health department has worked cooperatively with all of our regional jurisdictions, St. Louis City, Franklin County, Jefferson County, and St. Charles County for the past 3 months. Worked with them very intensely over the past 2 months, and I really think that our cooperation with St. Louis City is much more sophisticated than it was reported in that particular article. I did receive an email from Will Ross, Dr. Ross, yesterday expressing his disappointment about how his comments were reflected in that article. But regardless, I do think it's an important topic that needs to be discussed. I think that it's good that we're seeing publications about contact tracing because it's very important for our community moving forward. But when we're asked to help, we help. St. Louis City has handed off contacts in St. Louis County that they've discovered through their contact tracing, and St. Louis County has followed up on those. The Federal Stimulus Act does prevent us from just sending funds directly to another county. We can send funds to municipalities within our borders, but the law prohibits sending them out of our borders, and that's pretty clear. But having said that, we are working cooperatively with the city on our humanitarian response, and our efforts are combined there. We're working cooperatively with the city on our public health response, and if St. Louis City wants more help with contact tracing, we're certainly willing to help them. As far as the effectiveness of their contact tracing, that's really not for me to say. I'm not that involved in their operations, but I know they're working closely with our health department.
A follow to that is, are you concerned about the impact in the region of the city's small contact tracing effort?
Yeah, I don't think that's my position to try and understand or criticize the public health response in another jurisdiction, but I do recognize that they're working with us much more than people realize or know, And, there's a tendency, especially in a political season, to try and identify a small difference and shine a light on it. But I think looking back at our regional's response, I think it's been incredibly coordinated with our decisions, which have, for the most part, between the city of St. Louis, and our restrictions are pretty close, with very few differences, and that will continue. I think we have to recognize that the city of St. Louis demographically is a little different than St. Louis County, but we're close in a lot of ways, and the decisions we make, if there's any variation at all, will be because of different demographics. But we talk all the time, we're working closely together, and efforts to describe anything different, I think, are just largely political and a byproduct of campaign season.
You mentioned earlier that the county's restrictions on who they can give that money to. So you can give money to municipalities within St. Louis County.
Right.
And the question related to that is, do you feel $47 million in aid should be given to the munis, and how will you be able to guarantee the money is used by those 88 municipalities in a way that will be accepted by the U.S. Treasury?
Okay, so the question is about St. Louis County's ability to support the municipalities with our federal CARES Act stimulus grant. And we're working through those questions. The original guidance we have from the U.S. Treasury through their frequently asked questions that are published online and sent to us in writing is that, in the legislative language of this federal bill, is that the CARES Act stimulus funds that were sent directly to St. Louis County have to be spent within St. Louis County's borders. They have to be spent to support COVID-19 related activities that were not part of a budgeted expense for 2020 and that are not used to replace lost revenue from taxes. And so following those guidelines, we're seeking additional clarification to see how we can help our municipalities, because we want to. And if we can help them with shoring up their budget, if we can identify that pathway, then it also would allow us to shore up our budget for the services we provide in unincorporated St. Louis County, which is about a third of St. Louis County. So we have to get Treasury guidance on exactly how to do that. If we are wrong and we move the money, we transfer money to municipalities in a way that is not allowed under the federal grant, then they would have to repay that, we would have to repay that, and not only would our budgets be upside down by having to pay that back, that would have been funds that could have been spent on humanitarian relief, support for small businesses, support for a public health department, that wouldn't be available to do that. So what I asked our staff to do is to set aside $47 million, which is what our municipalities identified as their need through the Municipal League in our conversations. And I've been talking to them for a month to please start tabulating your COVID-19 related expenses so we can find a way to help support that. That's the strict criteria of this federal grant, so we do not get into trouble with the U.S. Treasury or the Inspector General. We want to get these funds into the community, helping people as soon as possible, but I have no interest in getting crossways with federal law. Any other questions? Okay, thank you, and again, have a great Memorial Day weekend. Remember those who have served our country. This is a weekend